Hello everyone, this is your student nurse Marinel once again, and for today's video I will be sharing to you how to do bed bath and bed shampoo. But before we start with these procedures, let us first try to understand who are the patients that we will be performing these procedures to and what are these procedures. So from the word itself, bed bath and bed shampoo, we are performing these procedures to bedridden patients. Bed shampoo is the activity wherein we are washing our patient's hair and scalp, and when we say bed bath, this is when we give bath to our patient on bed. And now we will be talking about the purposes of these two procedures. The first purpose of our bed bath is that it cleanses and refreshes skin of our patient, which provides them comfort. It also stimulates circulation and elimination because we are encouraging our patients to avoid using urinals. And lastly, it is also a good opportunity for us student nurses and nurses who are already working in the hospital to observe our patient's body for any abnormalities. Now we will be talking about the purpose of bed shampoo to our patient. First is that it cleans our patient's hair and scalp. Second is that it promotes good circulation of blood to the scalp of our patient. And lastly, it promotes the well-being of our patient. The next thing that we will be doing is that we have to check for our patient's record for any physician's order or any contraindications of doing such assessment to our patient. The next thing with that is that we have to verify our patient's identity. I am now holding my patient's record, and the next thing to do is to check for physician's order. Physician ordered bed bath and bed shampoo because patient is bedridden and limited self-care activities is also affected. The next thing that we will be doing is that we will go to our patient to verify the identity and to make sure that we are giving proper procedure to our patient. Hello sir, how have you been? My name is Marinel. I will be your student nurse for today. Would that be okay with you? Okay. So sir, can I please have your wristband for me to verify your identity? Can you please state your name?
And Yusuf,
Birthday?
March 11.
Okay, very good. Sir, I've reviewed your records here, and physician's order is that I will be performing bed bath and bed shampoo with you. So, atong shampoohan imong ulo, dayon, ato ka trapuhan, okay ra nimo? When ka last time na trapuhan, sir?
Adlaw.
Tungod sang adlaw? Okay, so sir, before ta magsugod, sir, pangutanon ra tikaw if ganahan baka nga mo manghihidaan? Dili ra. If kahion ka sir, please tell me kay naara tayo urinal diri, okay? Ingna lang ko sir ha. Kung kahion ka. The next thing that I will be doing sir is that I will be closing the door and the curtains for you to provide privacy, okay? So I will now be closing the curtains, closing the door, and sir, I will be preparing the equipments that are needed. So here are the equipments that we will be needing for bed bath and bed shampoo. We also have our bath towel and bath blanket. We also have here 2 basins and a pitcher filled with water. Materials are now prepared. I will be doing my hand hygiene, okay? This is for infection control. Sir, can you move in the edge of the bed? Badol ka diri nako. Okay. Now, sir, I will be wearing my gloves. Okay, so sir, I will be placing this. Place bath blanket over top sheet and fold and remove top sheet from under the blanket. Let the patient hold the bath blanket while you withdraw the top sheet. Remove patient's gown while maintaining privacy. Fill the basin with 2/3 full lukewarm water and have the patient place fingers to test temperature tolerance. Place bath towel across patient's chest. Remove patient's pillow and place bath towels under patient's head. So sir, I will be now submerging my washcloth to our water, and we will be cleaning your eyes first. Sa mata ta maguna, from your inner canthus to your outer canthus, okay? So, submerge washcloth to water. And knead the washcloth. Like this one. Okay. Close eye. So sir, usay ganahan nimo, butangan natog sabon imong kuan, trapo or tubig ra tanan? Tubig ra, okay? So next sir is we will be bathing your forehead, padulong sa imong cheeks, forehead to nose, then to ears and to your neck, okay? Okay ra? So ako ikapon imong buna sir ha? Forehead to cheeks, then forehead to the other side of the cheek, the nose, ears, to the neck, gas. So after sa imong face sir, we will be now moving sa imong arms, okay? So akong kaon ni sir. You place it here. Butang lang dito imong arms sir. Okay. So the next is that we will be wiping our patient's arm from fingertips going to the axilla in a long, firm strokes. Make sure to properly wipe the area between fingers. Okay. Pat to dry. Here, the upper arm, pat to dry again. Sir, pwede nimo erase imong arm nako, ibutang sabuna so that matrapuhan nato ang ilok, okay? Sir, ganahan ka butangan nato kuan, deodorant imong ilok. Butangan nato. Sure ka? Okay ra? So sir, we are done with your right arm. Mubalhin ko diri sa left arm nimo, okay? Ta sa imong left arm. This to gray sir. We have to knit our cloth properly like this one. Okay, so so we will be starting on the fingertips of our patient. Provide special care on the areas between the fingernails. Tap to dry. Tap to dry again. Okay, so sir, release your The next thing that we will be doing is that we have to change the water, and also we will be submerging the fingers of our patient to the water to know his temperature tolerance. Change water and check temperature of bath water. Spread a towel across patient's chest and lower bath blanket to patient's umbilical area. With one hand, lift edge of towel away from chest, and with mitted hand, bath chest using long firm strokes. Pat to dry. Place bath towels horizontally across the abdomen first and then across the chest. And then fold the blanket down just above the pubic region. With one hand, lift edge of towel away from chest, and with mitted hand, bath abdomen, giving special attention to the umbilicus and abdominal folds of creases. Remove the two towels and assist the patient in a side-lying position. Also your legs. Takilid sir, dito tubang. Okay? 3, 2, 1, takilid. Position bath blanket and towel to expose only the back and the buttocks. Use long, firm strokes. Expose near leg by folding blanket over towards the midline. Be sure that the perineum is draped. Bend patient's leg and knee by positioning your arm under the leg. Okay, so it should be from the ankle to the knee. Next thing is we will be bathing our patient's feet, placing effort or extra attention to the areas between the two nails. Proper knitting. So we will be using another water and another damp cloth. Can you check the temperature for me? Check the temperature. Like that? Good. Okay, very good. Sir, can you raise your leg? If you cannot, I will be helping you. Okay, very good. Start from the ankle to the knee. Ankle to knee. Tap to dry. Then to the knee to here. Tap to dry again. Submerge damp cloth. Then let's move to the feet, paying extra attention to the areas between the two nails. Okay. Tap to dry. Okay. Next thing is that we will be discarding the water and the damp cloth, and we will be removing our gloves. So we are done with our patient's bed bath. The next thing that I will be doing is providing my patient with bed shampoo. Okay? We will now be proceeding to our bed shampoo. The first thing that we need to do is to sanitize our hand again. And we will be assessing and inspecting our patient's scalp if there is any dandruff or lesions or any lice and nymphs that we can find within it. If there is any lesion, then you shall be wearing gloves, but in my patient's case, no lesions and no lice. Okay? So sir, I will be preparing the equipment that you will be needing. Okay? The first equipment that we need is our basin, our pitcher filled with water, our shampoo, conditioner, comb, and we also have our bath towels here and a sterile patient's gown. Okay. So sir, we will now be starting with our bed shampoo. Okay?
Assist patient to lie diagonally across bed with the head near the edge of the bed. Place bath towel on top pillow.
Next is that we will be using our kelly pad. So improvised kelly pad. Okay, sir? Next thing is that we will be putting a bath towel on our patient's neck. So sir, can you lift it for me? Put cotton balls to the ears of our patient. Okay. And a washcloth to cover patient's eyes. Comfortable na, sir? Check for the temperature of the water. Apply shampoo. Okay, so the next thing that we will be doing, sir, is I will rinse your hair na, okay? Okay? Kung banlawan, sir, ha? After rinsing our patient's hair, have to squeeze it. Then discard the water that is in the basin. After discarding the water from our first rinse, let's do the second rinse. Then squeeze the hair. Sir, ganahan ka nga ibutingan pa nato conditioner, dili ra. Dili ra. Okay. You have to squeeze the hair so that most water particles will fall off. Okay. After that, okay, remove patient's covering the eyes and ears. Remove the jelly sheet. Oops. Fold it. Make sure that the soiled area is folded. Put it in the side, and then use the towel of your patient. Cover his. So sir, can you move balik ta paingon dito? Kabangan tikaw. Comfortable lang? Okay lang? Sir, I will be removing this. Thank you, sir. Place this together with your Kelly pad and the other equipments. Provide another bath towel to cover patient's pillow. So sir, can you move your head? Then you have to dry your patient's hair. So after it's dried, fold your bath towel, place it together with your Kelly pad, and then do grooming, comb your patient's hair. Sir, would you like me to use colognes? Na ako'y colognes dira, sir, ganahan ka?
Yeah.
Dili lang. The next thing that we will be doing, sir, after this, sir, is will be putting your patient's gown, ha? Mag-ilis na, sir, okay? Okay, rani mo? Okay. After that, next thing that we will be doing is that we will dress our patient with this sterile patient gown. So we are done with our bed bath and bed shampoo. Fresh na, dili nagingot ang lawas.
Hindi na.
Okay ra? Napakoy mabuhat para nimo, sir.
Wala na.
Ganahan kag lotion,
Yura.
deodorant, cologne. Ako'y cologne, sir.
Yura po.
Okay na? Okay, sir. So I will be doing aftercare and my equipments, and I will be doing hand washing afterwards. Okay? Thank you so much for your time, sir, and please stay safe. That's how you do bed bath and bed shampoo.